Let's talk about autism today. Autism or autism spectrum disorder, or also known as autism spectrum condition nowadays, is mainly associated with childhood, but we have so many adults with undiagnosed autism nowadays. In this video, we will go through the main signs seen in adult autism and also masking in women. So the main signs of autism in adult are: number 1, difficulty in understanding others' emotions and thoughts. Adults with autism often struggle to read subtle social cues such as facial expressions, body language, or tone of voice. This can lead to misunderstanding or make them appear detached or uninterested in others' feelings. For example, while in a conversation, when someone is very obviously distressed, they might just keep on talking about something which is completely unrelated to the topic, and they might not even realize what's going on. Number 2, anxiety in social situations. Adults with autism may experience intense anxiety over what to say, how to act, or how to keep up with social norms. This often leads to avoiding social gathering altogether. It is quite common that autistic adults would just leave the party because they just find everything quite overwhelming. They're not being rude. This is how they function, and I think all of us should understand this. Number 3, preference of solitude. Many autistic adults prefer their own company because social interactions can be exhausting. It's not that they dislike people, but being around others for long periods of time can be overwhelming. For instance, after having a long day of interacting with colleagues, an autistic adult might need some alone time or quiet time just to recover from the mental fatigue. Number 4, appearing blunt, rude, or uninterested. Adults on autistic spectrum often communicate directly, which can sometimes be perceived as rudeness or lack of empathy. Again, this isn't intentional. For example, they might respond to a colleague's idea as a straightforward, "it won't work." Instead of giving a more diplomatic answer that "I know where you're coming from, but I don't see this working, what do you think?" they would just give you a very straightforward, blunt reply. Number 5, taking things literally. Autistic adults often interpret language literally, which means they may struggle to understand sarcasm, metaphors, or idioms. This can lead to confusion in everyday conversation. For instance, if you say "I'm pulling your leg," they might actually check if you're pulling their leg or not. Or if you say it's raining cats and dogs, they might look outside to see if animals are falling off the sky. Number 6, strong need for routine. Routine provides a sense of security for many autistic individuals. Sudden changes to plans or unexpected events can cause significant stress and anxiety, as they rely on structure to feel in control. For example, a last-minute change of a meeting might cause them a lot of anxiety, and they might just dwell on it all day long. So now that we have discussed the main signs of autism, let's go to the other signs of autism. Number 1, difficulty following social rules. Social conventions such as waiting for their turn to speak or knowing when to stop talking can be difficult for autistic adults to navigate. Number 2, avoiding eye contact. Eye contact can be uncomfortable or overwhelming for many autistic adults. While this is often interpreted as disinterest or dishonesty, but it's actually a coping mechanism for them to overcome the sensory overload. Number 3, sensitivity to physical boundaries. Autistic adults may struggle with understanding personal space. They might stand too close to others without realizing it, or become upset if someone unexpectedly touches them. Number 4, sensory sensitivities. Autistic adults often have heightened sensitivity to certain sounds, smell, texture, or light. Sensory overload can make everyday environment quite overwhelming for them. Number 5, intense focus on specific interests. Many autistic adults develop deep, specific interests that they can spend hours or even days focusing on. These special interests are often pursued with incredible dedication and enthusiasm. Now, these are autistic symptoms that are seen in all the adults. But there is something very interesting. Women are masters in masking autism. Autism may present differently in women, making it even harder to diagnose. And it is quite fascinating how women mask this just to fit in with the neurotypicals. But the reality is quite sad. Number 1 is social expectation. Society generally expects women to be more empathetic, more sensitive, and have better communication skills. So if it's an autistic woman, she will try to adapt it just to fit in with the neurotypicals, which makes it harder for anyone to diagnose it. Number 2 is avoiding negative attention. They don't want any negative attention because there's a lot of stigma around it. Number 3 is internalized coping strategy. For a lot of women, this becomes as an internalized coping mechanism, and they just develop second personality sometimes, which is very exhausting, and they might burn out. Late diagnosis of autism in women is quite common in our society. Overall, autism in adults can be quite subtle, but it is very crucial that we start understanding so we can be self-aware, and if we think that we have any symptoms, you can obviously talk to your healthcare professional. And if you think someone else or your loved ones have any of these symptoms, it is best to speak to a healthcare professional. And apart from this, if you're working with a colleague who has all of these things, it just makes it easier for you to understand how to adapt and to understand that this is not what they intend to do, but this is how their brain really works. If you found this video helpful, please like, share and subscribe. Thank you for watching.